Any questions? So now I welcome Dr. Lakshmi for the session. Lakshmi Miss, you can begin.
Thank you, Shravan. Thank you for the introduction.
Thank you.
Good evening, everyone.
Good evening, ma'am.
Good evening,
Good
ma'am.
evening, ma'am.
Good evening. So let me please, very good evening to each and every one of you. Let me please share my screen and then we will begin. Okay. So I hope my screen is visible to everyone. Shravan, is it visible?
Yes,
Yes,
Miss, you can
ma'am.
go ahead. Yes.
Okay,
Very
thank you so much. So as you can see on my screen, today I'm here to discuss with you the changes that they have made in the ICD-10 CM code for the year
Excuse me,
of
ma'am.
2024.
Excuse me. Someone
Yes,
messaged that they can't hear.
it will be the problem with their audio because others can hear, right?
Yes.
Yes,
Yes,
ma'am.
ma'am.
Yeah, so
Yes,
then the
ma'am.
issue is with them. Yeah. So as we all know, ICD-10 CM, International Classification of Diseases, 10th revision, and clinical modification. So these are a set of codes that are used by the physicians and other organizations for the accurate documentation of diagnosis, symptoms, and then certain other informations that are relevant to the patient's health. So they keep updating these codes every year. So the updation of ICD-10 CM codes happen in every October. So CMS has provided ICD-10 CM coding updates for the financial year beginning October 1, 2023 and ending September 30, 2024. So they have a set of guidelines that are to be used, to accompany and complement the conventions that are already available in the ICD-10 CM codebook. So these guidelines have been approved by 4 organizations that they actually make up the cooperating parties for the ICD-10 CM. So those 4 organizations are the American Hospital Association, AHA, the American Health Information Management Association, or AHIMA, the Centers for Medicare and Medicaid Services, that is CMS, the National Center for Health Statistics, NCHS. So actually, it is a joint effort between the physician and the coder to achieve optimum accurate documentation and optimum coding, accurate assignment of accurate diagnosis codes based on all the guidelines and conventions that are available in our ICD-10 CM book. So if we look at the changes that they made in 2024, compared to the previous years, the changes are minimum. We can say that, they have not made any major changes in the guidelines and also related to the codes. So first, we will have an overview of the codes changes that are made for the year of 2024. Later on, we will move and see the changes that are made in each chapter specific guidelines. But like I already mentioned, the changes are very few if we compare with the changes that has made in the previous years. So if we look at the summary of 2024 code updates, on June 26 to June 16, CMS announced 395 new diagnosis codes, 25 deletions, and 13 revisions for the year of 2024. So, our 395 new codes introduced ചെയ്തിട്ടുണ്ട്, 25 codes delete ചെയ്തിട്ടുണ്ട്, 13 revisions. So revisions means they have made some changes, they have added few information or they have removed few informations from certain codes. So now we will move on to the chapter specific guidelines. So the first chapter, chapter 1, certain infectious and parasitic diseases, code starting from A00 to B99, and also the COVID-19 codes. So if we look at this chapter, they have changed some guidelines. Okay, they have made few changes in the guideline. So they have made a minor change in guideline related to post-procedural sepsis code range. And they have done a major change when it comes to coding for screening of COVID-19. So we will see both the changes in detail. So when it comes to post-procedural sepsis. So in 2023, the rule was whenever we are coding for post-procedural sepsis, that is infection following a procedure, we have to report a code from T81.40 to T81.43 first, followed by the code for the post-procedural sepsis. So there were 4 codes, T81.40, T81.41, 42, and 43. So in 2024, they have slightly changed that instruction alone. So for 2024, for sepsis following a post-procedural wound or infection, a code from T81.41 to T81.43 should be sequenced first. അപ്പം വളരെ ചെറിയ ഒരു ചേഞ്ച് ആണ്. ഇത്ര നമ്മൾ 2023 പറഞ്ഞിരുന്ന കോഡ് റേഞ്ച് T81.40 തൊട്ട് T81.43 വരെ ആയിരുന്നു. ഇപ്പൊ അവരത് 40 റിമൂവ് ചെയ്തിട്ടുണ്ട്. Now the code range for reporting post-procedural sepsis will be T81.41 to T81.43. Moving on to the next change. So this is the major change that they have made for the year of 2024. So we all know that it was a year of pandemic for all of us. COVID-19 was considered as a pandemic. So we had a screening code available for COVID-19 in our book previously itself. So the code was Z11.52. But according to the guideline, the rule was during the COVID-19 pandemic, a screening code is generally not appropriate. So do not assign the code Z11.52 encounter for screening for COVID-19 for encounters of COVID-19 testing, including pre-operative testing. Instead, code it as exposure to COVID-19, Z20.822. So since the pandemic was going on, they didn't feel that it is right to report the screening code for COVID. So we were asked to use the exposure code at that time. But from 2024 onwards, for screening for COVID-19, including pre-operative testing, assign the code Z11.52 encounter for screening for COVID-19. ഇപ്പൊ പാൻഡമിക് സ്റ്റേറ്റസ് ഒക്കെ ലിഫ്റ്റ് ചെയ്തു. സോ അതുകൊണ്ട് തന്നെ ഇനി മുതൽ പേഷ്യന്റ് വരുന്നത് COVID-19 സ്ക്രീനിങ്ങിനാണ് എന്ന് പറയുന്നുണ്ടെങ്കിൽ we can report the screening code. The screening code is Z11.52. അപ്പൊ ഇനി മുതൽ COVID-19 സ്ക്രീനിങ്ങിന് എക്സ്പോഷർ കോഡ് വേണ്ട, നമ്മുടെ ബുക്കിൽ അവൈലബിൾ ആയിട്ടുള്ള സ്ക്രീനിങ് കോഡ് തന്നെ നമുക്ക് യൂസ് ചെയ്യാൻ പറ്റും. So these two are the changes that they have made in the guidelines related to chapter 1. Now let's move on to chapter 2. So the chapter 2 had code for neoplasms. So C00 to D49. So in this chapter, we had code for all type of tumors, malignancy, metastatic tumor, benign neoplasm, uncertain behavior and all. And we had certain guidelines also. So we had guidelines related to, encounter for therapy, encounter for surgery and all. So they have not made any changes in the guidelines. Okay. When we look at the guidelines in chapter 2, that is neoplasms, they have not made any changes in the guidelines. But some new codes are added to this chapter for the year of 2024. So I'll show you few codes because it's So one such code is for a condition called FAP, familial adenomatosis polyposis. So it is actually a genetic condition in which, a person develops multiple colon polyps. So if not treated well, it can lead to colon cancer in future. So they have added a new code to represent FAP, D13.9. Another new code that they have added to this session is for a condition called desmoid tumors. So desmoid tumors are non-cancerous tumors. They are tumors of connective tissue. So based on the location of the tumor, they have given a number of codes for desmoid tumor. So from D48.110 to D48.119 based on the location of the tumor. So moving on to the next chapter, chapter 3, diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism. A very small chapter with code range from D50 to D89. So in this chapter, we had codes for blood-related disorders. So disorders like anemia, leukemia, and all. So as it is, there were no guidelines in this chapter, and that remains the same. They have not added anything new to any instruction related to this chapter. So reserve for future guideline expansion. Moving on to the fourth chapter, chapter 4, endocrine, nutritional, and metabolic diseases. Code ranges from E00 to E89. So in this chapter, we had codes related to all the problems related to the hormone supply in our body. And we had guidelines. We had guidelines related to reporting of diabetes and all. So there are no changes in guidelines in this chapter as well. So all the guidelines are related to coding for the chap E codes remain the same. But they have added some new codes. Quite a number of new codes have been added to this chapter. Few examples will be, one condition is autosomal dominant hypocalcemia. So it is a rare disorder. It is actually a rare disorder that will affect the calcium homeostasis in a patient's body. So what happens is, due to mutation in the genes, there will be a decreased amount of calcium in the patient's blood. And there are two types, ADH1 and ADH2. So they have added a new code, E20.810, to report ADH. Another condition for which they have added new codes are for metabolic syndrome and insulin resistance syndrome. So here, actually, our pancreas, and the work of pancreas is to produce insulin. So pancreas will produce insulin, then that insulin will be absorbed by the cells in our body. And then that will be used for the conversion of glucose into energy. So that is the normal mechanism that should be happening. But in case of insulin resistance syndrome, because of some reason, the cells in the body will not be able to absorb the insulin. So because of which that conversion of glucose into energy will not happen. So there will be increased levels of glucose in the patient's blood. So they have added a number of codes to represent that particular condition. Moving on to the next chapter, chapter 5, mental, behavioral, and neurodevelopmental disorders. Codes starting from F01 to F99. So in this chapter, we had guidelines related to use, abuse, and dependence of substance. We also had guidelines related to coding for dementia and all. So there are no changes in the guidelines. They have neither added anything nor deleted anything from this particular chapter. And they have not added any new codes also to this chapter. Moving on to the next chapter, chapter 6, diseases of the nervous system. So the code range will be from G00 to G99. So in this chapter, we had guideline related to reporting of type of pain, like chronic pain, acute pain and all. There were different instructions. We'd also had guidelines related to reporting of plesias. So none of the guidelines have been changed. The guidelines remain the same when it comes to chapter 6. But they have added lot of new codes to this chapter. So one such code is for chronic migraine with aura. So chronic migraine, when you say chronic migraine, it is a condition where you have frequent or long-lasting episodes of headaches and migraine. So generally what they say is, if the patient is having continuous migraine-like headache for nearly 15 days in a month, which is happening for nearly 3 months, then they consider it as chronic migraine. So in 2023, in our book, we have codes for chronic migraine without aura and then all the associated subcategory. This year, they have added codes for chronic migraine with aura. Then there is further subdivision based on whether that condition is intractable or status migrainosus and all. So they have added a set of new codes to the subcategory chronic migraine with aura. Moving to the next chapter, diseases of the eye and adnexa, codes ranging from H00 to H59. Again, there are no changes in the guidelines. Okay, whatever guidelines were there related to coding for glaucoma, blindness, low vision, everything remains the same. And yes, they have added new codes to this chapter. So one such code is a set of codes are added to identify a condition called extraocular muscle entrapment. So this extraocular muscle entrapment is when extraocular muscles or associated soft tissue become entrapped in an orbital bone fracture. So extraocular muscle means the muscles, the 6 muscles that are supporting our eye. So there are 2 horizontal muscles, medial rectus and lateral rectus. Then there are vertical muscles, superior rectus, inferior rectus, superior oblique and inferior obliques. So depending upon the muscle that is involved in the entrapment and also the laterality of the eye, whether it is right eye, left eye or unspecified eye, we have different codes to report. Actually, this condition, this extraocular muscle entrapment, it is a common problem encountered by the emergency department, and if not treated well, it can lead to life-threatening complications. So a set of codes from H50.62. So if you look at the code 62, inferior oblique muscle, 63, inferior rectus muscle, 64, lateral rectus muscle, then 65, medial rectus muscle, then 66, superior oblique muscle, then 67, superior rectus muscle, and then 68, unspecified muscle entrapment. So based on whichever muscle is involved in that particular condition, they have given a number of codes. Next chapter, chapter 8, diseases of the ear and mastoid process. Codes ranging from H60 to H95. Again, as it is, there were no guidelines when we, code from this section. It remains the same. This section is reserved for future guideline expansion. Chapter 9, diseases of the circulatory system. So code starting from I00 to I99. So in this chapter, again, we had a number of guidelines related to coding of hypertension, coding for myocardial infarction and all. So they have not changed any of the guidelines. So all the guidelines that are related to reporting of hypertension or reporting of myocardial infarction, everything remains the same. But they have added some important codes to this section. Okay, so we will see the codes in detail now. One code they have added to this section is for a condition called resistant hypertension. So resistant hypertension refers to blood pressure of a patient with hypertension that remains above goal in spite of the use of antihypertensive medication. So this particular patient is having some type of BP. It can be from any like a category from I10 to I16 based on the type of BP that the patient is having. Patient is taking medication, but in spite of taking the medication, the BP levels are not coming down. But doctor prescribe the correct amount of medicine കഴിച്ചിട്ടും പേഷ്യന്റിന്റെ BP control ആവുന്നില്ല. ആ ഒരു കണ്ടീഷനെയാണ് resistant hypertension എന്ന് പറയുന്നത്. So, if the documentation shows that the patient is having resistant hypertension or true resistant hypertension, we have a new code to report that particular scenario. The code is I1A.0. അപ്പൊ നമുക്ക് തന്നിരിക്കുന്ന ഡോക്യുമെന്റേഷൻ, നമുക്ക് തന്നിരിക്കുന്ന കേസ് ഷീറ്റില് പേഷ്യന്റിന് റെസിസ്റ്റന്റ് ഹൈപ്പർ ടെൻഷൻ ഉണ്ട് എന്ന് ഡോക്ടർ ഡോക്യുമെന്റ് ചെയ്തിട്ടുണ്ടെങ്കിൽ we can report the code I1A.0. So a code for the specific type of existing hypertension is sequenced first if known. Like I already mentioned, we have different category. I10 primary hypertension, I11 hypertensive heart disease, I12 hypertensive CKD. Like that, we have codes till I16. So if we know the exact type of hypertension the patient is having, code that first. Then if the documentation shows patient is also having resistant hypertension, that means in spite of taking the prescribed medication, the values are above goal. So the code that we have to give is I1A.0. So it is a new code that has been added to the I series this year. Another new code that they have added is for a condition called myocardial infarction with coronary microvascular dysfunction. So here we all know that our heart is supplied by coronary artery and the branches of coronary artery. So usually we call it MI when the artery is blocked and the blood supply to the heart muscles are obstructed. But in case of coronary microvascular dysfunction, what actually happens is there is no plaque deposition in the major arteries. So there is enough oxygen-rich blood supply through the major arteries, but the inner lining of the smaller vessels that are branching out from the major arteries are defective. So because of the same reason, the heart muscles are not getting enough blood supply. അപ്പം ഈ ഒരു സിറ്റുവേഷനിൽ മേജർ ആർട്ടറീസിൽ കുഴപ്പമൊന്നുമില്ല, ബ്ലഡ് സപ്ലൈ നന്നായി നടക്കുന്നുണ്ട്. ബട്ട് അറ്റ് ദ സെയിം ടൈം അതിൽ നിന്ന് ബ്രാഞ്ച് ഔട്ട് ചെയ്ത് പോകുന്ന കുട്ടി കുട്ടി കാപ്പിലറീസ് ആർട്ടീരിയോൾസിലൊക്കെ അതിന്റെ ഇന്നർ ലൈനിങ് വീക്ക് ആയതുകൊണ്ട് ഹാർട്ട് മസിൽസിലേക്ക് ബ്ലഡ് ശരിക്കും സപ്ലൈ ആവുന്നില്ല. സോ ഇഫ് ദ കേസ് ഷീറ്റ് ഇൻഡിക്കേറ്റ്സ് ദാറ്റ് patient is having myocardial infarction with coronary microvascular dysfunction, we have to assign the code I21.B. So it is a new code. So what they are telling us, assign I21.B if the case sheet indicates that patient is having myocardial infarction with coronary microvascular disease, myocardial infarction with coronary microvascular dysfunction, myocardial infarction with non-obstructive coronary arteries with microvascular disease. If the documentation shows that the patient is having any of these conditions, we have to assign the code I21.B. So along with this, they have added one new code to angina pectoris. So I20.81, angina pectoris with coronary microvascular dysfunction. So if the patient is having angina with coronary microvascular dysfunction, a new code is available to report that particular situation, I20.81. So these are all the changes that they have made to the I series. So guidelines are not changing, but two new important codes have been added to this section. Moving on to the next chapter, chapter 10, diseases of the respiratory system. So the codes ranging from J00 to J99. Again, here we had codes for, we had guidelines related to coding for influenza, ventilator associated pneumonia, vaping related disorders and all. None of the guidelines have been changed. So if we check if they have added any new guidelines to this chapter, the answer is no. But again, they have added few new codes to this chapter. So one such code is J15.61, pneumonia due to Acinetobacter baumannii. So Acinetobacter baumannii is a gram-negative bacteria. So as it is, we have combination codes for pneumonia and certain other gram-negative bacteria like Klebsiella, E. coli and all. So this year, they have also added a code for pneumonia due to Acinetobacter baumannii. The code will be J15.61. Moving on to the next chapter, chapter 11, diseases of the digestive system. The codes ranging from K00 to K95. So we never had any guidelines so far in this chapter, and that remains the same this year as well. So this chapter is reserved for future guideline expansion, but they have added a lot of new codes to the case series. So I'll show you some examples. One code is for a condition called retroperitoneal fibrosis. So in retroperitoneal fibrosis, so there is a scar-like tissue formation in the retroperitoneum, and the code is K68.2. Another condition is retroperitoneal hematoma. Again, there is bleeding into the retroperitoneal space. So the reason can be any surgery, trauma and all. So K68.3 will be the code. Another code is intestinal failure. So the function of our intestine is to absorb the nutrients from the food. So intestine is not able to do it properly. So our gut is not able to absorb the nutrients, that is the carbohydrates, proteins, vitamins, and the fluids from the food. So that condition is coded as K90.83. And then they have added a number of new codes to the code range of acute appendicitis with generalized peritonitis. So actually until 2023, we had codes for acute appendicitis with localized peritonitis. So this year, they have added a new range of codes for acute appendicitis with generalized peritonitis. So generalized peritonitis means there is widespread infection in the peritoneum. There is abdominal tenderness and all. And then two set of codes based on whether abscess is present or not. So K35.20 category, acute appendicitis with generalized peritonitis without abscess, and K35.21 category, acute appendicitis with generalized peritonitis with abscess. Moving on to the next chapter, chapter 12, diseases of the skin and subcutaneous tissue. So the code range will be L00 to L99. Again, we had codes for recording of documentation of pressure ulcer, acute ulcers, healing ulcer, healed ulcers and all. So they have not made any changes in the guidelines. They have not added any new codes also to this section. So both are no. Changes in guideline is also no. Addition of codes is also no when we consider the code range of L00 to L99. Next chapter, M. Chapter 13, diseases of the musculoskeletal system and connective tissue. So the codes ranging from M00 to M99. Again, in this chapter, we had codes, we had guidelines related to coding of pathological fracture. We also had codes related to, diseases that is affecting the bones and muscles in the patient's body. So none of the guidelines have been changed. So they have not changed any guidelines in this chapter, but they have added a number of new codes to this chapter for further expansion of certain conditions. So one example is they added new codes to further define age-related osteoporosis with pathological fracture of pelvis. So earlier we didn't have the entry for pelvis when related to osteoporosis. So they have added quite a new number of codes to represent age-related osteoporosis with pathological fracture of pelvis. Then the codes change based on the laterality, right, left, and unspecified. Moving on to the next chapter, Chapter 14, Diseases of the Genitourinary System. Codes ranging from N00 to N99. Again, in this chapter, we had guidelines related to reporting of CKD, chronic kidney disease. They have not changed any of the instructions. All the guidelines remain same in chapter 14 for the year of 2024 as well. But again, they have added few new codes to this chapter. So examples will be, one condition is immunoglobulin A nephropathy. So there are a range of new codes added to show immunoglobulin A nephropathy. So it is a condition in which there is a buildup of IgA antibodies in the patient's kidney, which in turn, damages the glomeruli. So they have given a range of codes to represent that condition. Another condition is nephrotic syndrome. To represent that also, a range of codes are available. So nephrotic syndrome is a condition in which there is proteinuria. So excessive loss of protein through the urine in patients. And the reason is increased permeability of the glomeruli. So to represent nephrotic syndrome, a new range of codes have been introduced. Another condition for which a new range of codes have been introduced is isolated proteinuria. So again, there is excessive loss of protein through the urine, but without any underlying causes. So patient is not having any underlying disease condition, but still the patient is having proteinuria. Then it is called isolated proteinuria. So these are all some codes that they have added to the category of NCDs. Moving on to the next chapter, Chapter 15, Pregnancy, Childbirth, and Puerperium. Codes ranging from O00 to O9A. So we all know that pregnancy has a number of codes and a lot of guidelines related to reporting of different situations. And this chapter has sequencing priority over all other chapters in ICD 10. So they have not made any changes in the guidelines related to any condition that will come under chapter 15. So no changes in the guidelines. Again, they have added a new set of codes to represent a condition called intrahepatic cholestasis of pregnancy. So actually, it is a liver disorder that happens in pregnancy. It is kind of a serious problem. So usually, liver has bile. So from liver, the bile flows into the intestine. But in case of intrahepatic cholestasis of pregnancy, there is bile buildup in the patient's body. So because of that, the pregnant lady will be experiencing some discomfort. So usually found in the third trimester, but can happen at any time of pregnancy. So again, different range of codes based on whether the patient is in first trimester, second trimester, third trimester, or unspecified trimester. Moving on to the next chapter, Chapter 16, certain conditions originating in the perinatal period. So the codes ranging from P00 to P96. Again, there are no changes in the guidelines. Also, they have not added any new codes to the P category for the year of 2024. So no changes in this chapter. The next chapter, Chapter 17, Congenital Malformations, Deformations, and Chromosomal Abnormalities. Q00 to Q99. Again, there are no changes in the guidelines. Okay, they have not made any changes in any of the guidelines related to reporting of congenital disorders. But they have added few new codes to this particular chapter as well. So one such code is for a condition called Alagille syndrome. So again, in Alagille syndrome, the problem is it is an inherited disorder. So basically, from the liver, there are biliary ducts to drain the bile into the intestine. So in patients with Alagille syndrome, there are very few bile ducts available. Because of that, there is bile buildup in the patient's liver, which can even lead to liver failure and all. So if Alagille syndrome is there, they have given a new code, Q44.71. Another code range that they have given is for a condition called craniosynostosis. So this craniosynostosis, it is a birth defect in which, there'll be fusion of skull bones in an infant at a very early stage before the completion of brain development itself. So based on the laterality, like whether it is affecting unilateral side or bilateral, based on the sutures involved, coronal suture, sagittal suture and all, they have added a number of new codes ranging from Q75.001 to Q75.058 to represent craniosynostosis. Moving on to the next chapter, chapter 18, symptoms, signs, abnormal clinical and laboratory findings, R00 to R99. So for a change, if we check if they have made any changes in the guideline, the answer is yes. Okay, so from first chapter till now, we were just getting no for all the guidelines. But when it comes to our series, they have made changes in guideline, but very minor changes. Okay, so one such change is related to reporting of coma scale. One small change they have made. And NIH's stroke scale. Even smaller change they have made while coding for NIHSS stroke scale. So we will see what is the change that is made to the coma scale. So we all know that up to 2023, we had a code for coma, R40.20, that says unspecified coma. And the rule was it may be assigned in conjunction with code for any medical condition. Like basically, whatever medical condition that the patient had, which led to the coma. It doesn't matter whatever the condition is, we code for the condition, then to represent coma, we were using R40.20. അപ്പൊ പേഷ്യന്റിന് എന്ത് അസുഖം കൊണ്ട് കോമ വന്നാലും കുഴപ്പമില്ലായിരുന്നു, നമ്മൾ ആ അസുഖത്തിന് കോഡ് ചെയ്യും. അത് കഴിഞ്ഞ് കോമ സ്കെയിൽ ഒന്നും തന്നിട്ടില്ല എന്നുണ്ടെങ്കിൽ അൺസ്പെസിഫൈഡ് കോമ എന്ന് പറഞ്ഞിട്ട് R40.20 കോഡ് ചെയ്യും. And if the coma scale was given, we used to report the code for coma scale. So we all know, based on the eye response, verbal response, and motor response, we have different codes available to report the coma scale, R40.21 to R40.24. So that is what we were doing till now in 2023. If, whatever reasons that they give, we report the code for the reason, then we report either the code for unspecified coma, or if they have given the coma scale, we report the code for coma scale. So they have made a small change there for the year of 2024. So what they have done is code R40.20 unspecified coma should be assigned when the underlying cause of the coma is not known, or the cause is a traumatic brain injury and the coma scale is not documented in the medical record. So now they have given two conditions for reporting the code R40.20. So they are telling either the underlying cause of the coma is not known. So basically they don't know what reason led the patient into coma. Arnooda patient enganeya coma ilayadenu. അങ്ങനെയാണെന്നുണ്ടെങ്കിൽ we can report the code R40.20. Another condition is the cause of coma is a traumatic brain injury. So traumatic brain injury means the reason for coma is any trauma to the brain, the skull fractures, concussions. So basically brain in endingilum or external force ne konda injury aayi. അതായത് ഇപ്പൊ മൾട്ടിപ്പിൾ മോട്ടോർ വെഹിക്കിൾ ആക്സിഡന്റിലൊക്കെ പെടുന്ന പേഷ്യൻസ് ഇല്ലേ അങ്ങനെ because of some external force the patient had a brain injury that led to coma. In that scenario also, we can report the code R40.20. But these codes cannot be used with the code R40.2A non-traumatic coma due to underlying condition. So what they have done is they have added a new code to the range of coma in 2024. That code is R40.2A. It reads non-traumatic coma due to underlying condition. So that means the reason for coma is not a brain injury. It is something else. It can be any underlying disease condition like meningitis, encephalitis and all, or it can be any poisoning due to drugs, almost drowning, or any infarction, stroke and all. So if the reason for coma is a non-traumatic brain injury, from 2024 onwards, the code that we have to give is R40.2A. So basically coma reason vechittu coma ന് 2 set of codes കൊടുത്തിട്ടുണ്ട്. അതായത് if the reason for coma is a traumatic brain injury like fracture of skull, concussion, something related to the some external trauma to the brain, because of that patient went into coma, then use the regular codes R40.20, and if they have given the coma scale codes, code for them R40.21 to 24. But if the reason for coma is a non-traumatic brain injury. So, can you please mute your mic? Somebody has unmuted their mic. Can you please mute your mic? Okay, thank you. So if the reason for coma is a non-traumatic brain injury, so conditions like poisoning, epilepsy, seizures, or any infections like encephalitis, stroke and all led to coma, so here onwards, the coma will be coded using R40.2A. So we have to code first the underlying condition. So for example, if the documentation shows that patient went into coma due to meningitis, we code for meningitis first, followed by R40.2A to show that it is a non-traumatic coma due to underlying condition. Then the next change that they have made is for NIHSS stroke scale. So National Institute of Health stroke scale, a minute change in the code range. So this is actually, this scale is used for the documentation of severity of stroke in the patient. And the code range is R29.7. Then they have a number of codes based on the reading that is obtained from the patient. So the rule was the NIH stroke scale can be used in conjunction with acute stroke codes. So the codes from I-63 category, cerebral infarction codes. So whenever we are coding, whenever they report the stroke scale code, first they have to report a code from I-63 category, then report the stroke scale code. So for 2024, they have expanded that range. So from now onwards, the NIH stroke scale code can be used in conjunction with acute stroke codes ranging from I-60 to I-63. So they have expanded that range, including a lot of cerebrovascular disease conditions. So now the code range is I-60 to I-63. അപ്പം വളരെ ചെറിയൊരു ചേഞ്ച് ആണ്. സെപ്സിസിന്റെ കാര്യത്തിൽ പറഞ്ഞ മാതിരി തന്നെ ഇവിടെയും ആ കോഡ് റേഞ്ച് ഒന്ന് സ്ലൈറ്റ് ആയി മാറ്റിയിട്ടുണ്ട്. Moving on to the next chapter, chapter 19, injury, poisoning, and certain other consequences of external causes. So the codes ranging from S00 to T88. So in this range, we had a number of instructions related to reporting of injury codes, traumatic fracture codes. When it comes to table of drugs, there were different instructions for reporting poisoning, adverse reaction, underdosing and all. So none of the guidelines have been changed. So there are no changes in the guidelines in this chapter. They have added a set of new codes to the section of drugs. Toxic effect of gadolinium. So this gadolinium is used as a contrast material in the MRI scan. So sometimes, some patients develop some kind of toxic reaction to the gadolinium. They will have this giddiness, certain discomfort and all. So based on the intention of poisoning, like whether it is accidental, self-harm, assault or undetermined, they have added new codes to the range of toxic effect of gadolinium. Next chapter, chapter 20, external causes of morbidity. So the codes ranging from V00 to Y99. So usually we use external cause codes to show the reason for disease, injury and all. So there are no changes in any of the rules that are related to this chapter. But the maximum number of additions for the year of 2024 has been to this section. 123 new codes have been added to the range of W44. So actually what they have done is they have added a number of entries related to accidents and injuries and all. Like for example, accident due to any toy, injury due to any food, and then, button batteries, and then any magnetic object, organic or inorganic substance, toys went into any natural orifices like nose, mouth, ear and all. So they have added a number of new codes to the range of W44 to show more and more classification of accidents and injuries. Moving on to the next chapter, chapter 21, factors influencing the health status and contact with health services, Z00 to Z99. Again, in this chapter, we had codes that are used to represent certain information that is relevant to the patient's health. We also use E-codes to represent any encounter codes and all. So there are no changes in the guidelines in this chapter. So they have not made any changes in the guidelines, but they have added a number of new codes to this section. Some examples will be personal history of military service, Z91.85. Another code that they have added is encounter for HIV pre-exposure prophylaxis. Actually, PrEP. It is a medicine, okay? It is an antiviral medicine taken by an HIV negative patient before the expected exposure to HIV. So usually it is a combination, it is a set of 2 antiviral pills that the patient will take 24 hours prior to the exposure. Z29.81 will be the code. And then they have added a number of new codes to the category of social determinants of health. So the social determinants of health codes, they show the problems related to economic and social condition of the patient. So there are codes related to, lack of education, housing problems, unemployment, some physical problems and all. So they have added a new set of codes related to child custody. So child custody codes, a range of codes have been added to Z62 category in this series. Now moving on to the final chapter, chapter 22, codes for special purposes, U00 to U85. So far, we have only codes for 2 conditions in this chapter, codes for COVID-19 and also the codes for bathing disorder. So there are no changes in any of the codes and they have not added any new codes also to this chapter. So this is the chapter specific overview of the changes that they have made for the year of 2024. So by now you all must have realized they have made very minimal changes in this year. So നമ്മൾ നോക്കുകയാണെന്നുണ്ടെങ്കിൽ one major change that we can talk about is the screening of COVID-19. So from now onwards, if the patient is coming for screening of COVID-19, we can report the screening code. We don't have to report the exposure code anymore. Another changes, like some important codes like this resistant hypertension, coronary microvascular dysfunction and all is added to the ICDs. So if resistant hypertension is documented, after coding for the type of hypertension, we will also have to report the code for resistant hypertension. Then the next change that we can talk about is in the coma scale. So from here onwards, we have to look at the reason for coma. It can either be a traumatic brain injury or non-traumatic reasons. So traumatic brain injury, coma due to traumatic brain injury, use the already available codes R40.20 or 21-24. If the reason for coma is a non-traumatic brain injury, the code for coma is going to be R40.2A from here onwards. So yeah, that's it. So with this, I'm concluding this webinar on the changes of ICD-10 for the year of 2024. I really hope that you found this presentation informative and useful. Thank you all for your time and your patience.
Thank you, Dr. Lakshmi, for your insightful presentation. And it was so comforting to know that there were only a few changes in ICD 2024. And next up, we'll have the Q&A session. So if you have any doubts, just post it on the chat box and we'll discuss the whatever your doubt or concern is with Dr. Lakshmi. After that, we'll be sharing the link for CE. Dr. Lakshmi, Aditya Sabu have raised a question that she has asked that those who are writing the exam in November should refer these updates.
No, actually, I don't think so. They will come into effect in when we consider the exam, the changes will come only from January. So I think those who are writing in November, the rules remain the same. If I'm not wrong, we can still follow the rules for 2023.
Okay. Any other queries? So Fatima Wali have asked, can we have the notes? So unfortunately, you cannot have the slide, but we can do something even better. We'll be sharing the session, the recorded session in Cigma's social media pages. And it'll be available in YouTube. So I think that will be much better for you. And Dr. Naushila is asking, so these changes will be applicable on January 2024. Rashmi, miss anything to comment?
Yeah, I think that's what is going to happen. But someone from Cigma can, confirm that information. From someone from the exam side, then can confirm that information.
Okay, another question is from Vidya. Vidya has asked whether CPT have more changes.
Yeah, actually, they have published the changes related to CPT as well. So we'll be having a webinar on that soon. So that time we all will get to know what are the changes that they have made in CPT.
Thank you. Thank you. Any other queries? We'll be uploading the recording in our YouTube, and also we'll share it in our social media pages. Okay, you can access it from there also. Any other queries? Nobody has any queries regarding ICD? Okay, so I think that's about time. Okay, another question from Raima. Can you please describe what is autosomal dominant hypercalcemia? Any idea, Lakshmi Miss?
Okay, so autosomal dominant hypocalcemia, ADH. It is a rare disorder of calcium homeostasis. So basically, genes വരുന്ന മ്യൂട്ടേഷനെ കൊണ്ട് പേഷ്യന്റിന്റെ ബ്ലഡിൽ ഇനഫ് കാൽഷ്യം സപ്ലൈ ഉണ്ടാവുന്നില്ല. ആ ഒരു കണ്ടീഷനെയാണ് ADH എന്ന് വിളിക്കുന്നത്. അപ്പം ഇറ്റ് ക്യാൻ ഓൾസോ കം റിലേറ്റഡ് ടു hypoparathyroidism and all. So it is a rare disorder. It is a genetic disorder.
Okay, thank you, ma'am. And another asks, what is the fees for CPC exam 2024? That you can contact in our Cigma's exams and renewal center. They'll let you know. Okay. Okay, so right now I'll be sending the form for CEUs in the chat box. And before I'm sending the sending the link, let me give you a few instructions. Make sure you're entering the correct details, especially your correct name and your correct APC member ID, so and so. And the timing, only 10 minutes will be allotted for you for filling the form. So make sure you fill the form within 10 minutes. Okay. So I'll update it in the chat box so that you can take the link from there. Okay, I've sent the link. You can open the link and you can fill it. Okay. Please let me know if you have any issues. If any, please text me in the chat box. Okay, okay. Please stop spamming the chat box for a moment. Give me a minute. Okay, what about now? Is the link visible? Fine. Good.
Hi, Ashram.
So please fill the details correctly. Okay. Priya, member ID is your APC member ID. Okay. If once you have gotten the certification from APC, you'll get the APC member ID. That's what they are asking. You can enter that. Yes, Jamie, yes, you can. So if there is no more doubts, we can wind up the session. So before winding up, thanks a lot, Dr. Lakshmi, for the insightful presentation. And I'm taking this time to thank all of you, all the attendees who have joined this session and made this a successful session. And wish you all the best. And okay, you guys have a good night. Thank you all. Bye.